All new at 4:30, heart disease is the #1 killer of women and men in the U.S., but women are reporting that often they're being sent home without a diagnosis and being told their pain isn't real. Now, a new Yale-led study is looking to transform the diagnosis of heart disease. We are joined this afternoon by Dr. Sumit Shah, who is an interventional cardiologist at Yale New Haven Hospital. Dr. Shah, thank you so much for being with us.
Hi, Erin. Thanks so much for having me today.
So first off, I want to ask you about this. Do you believe we're actually seeing gender bias when it comes to cardiovascular medicine and these diagnoses of heart disease?
I think so. Historically, people have looked at heart attacks and we look for one thing. We look for a blockage in a blood vessel. And then even though we don't mean to do it, when we see women who come in and have heart attacks without a blockage, we don't look any further. We don't have the right diagnostic tests, and often women are left without a diagnosis. So in a way, it is gender bias, even though we as doctors have the best intentions and want to treat all of our patients appropriately.
We talk about all the time how heart disease is so common and so deadly, but it can look very different in men and women in terms of the symptoms. How do you distinguish them?
That's right. So there's research at Yale that's funded by Women's Health Research at Yale that has shown that women present differently. Women often don't have the classic chest pain that we're looking for when people come to the emergency department. And then when we do diagnostic tests, they may not look the same. And so we can do angiograms, which is what I do as an interventional cardiologist, and the blood vessels may be open. And so even though a woman comes in with nausea or jaw pain that looks and sounds like a heart attack, the blood work looks like a heart attack, we're not going to see the same type of blockage that we would usually see.
What ways are you trying to change testing for women's heart disease to advance the diagnosis?
So we have tremendous technology, and in the last few years, we've been able to apply it at Yale New Haven Hospital to take care of our patients. So we do a couple of things. We do testing for problems like coronary vasospasm, using medications that previously were not available. And currently, we're the only hospital in the state that can offer this service. We can also take a wire that's 14 thousandths of an inch and put it down into the blood vessels in the heart and very precisely measure the pressure and the resistance. And so it creates a lot of numbers that don't mean anything to the patients, but as a doctor, it helps us give a diagnosis and then base treatment on that diagnosis.
A lot of times women are quick to say, I don't need to go to the doctor. I'm okay. It must not be a heart attack. That happens to men. That is simply not true. What's your best advice to women who are watching right now?
So the whole reason that we started working on this and doing this research is that we see women come in the prime of their lives, in their 30s, 40s, and 50s, with heart disease and heart attacks, and nobody would ever expect it. And so now we have the tools to help treat people and get them back on track so they can live a full and healthy life. And so my advice is that take your body seriously. If you have new symptoms, even if somebody tells you, I can't find anything wrong, there usually is something wrong, and we just have to look a little bit harder.
Well, it is incredible the work you do and continue to do. Dr. Sumit Shah, cardiologist at Yale New Haven Hospital. Thank you again for taking some of your time to be with us.
Thanks so much, Erin.